thank you for coming in, Byron.
My pleasure.
Tell me how I can help you. I believe it's your nose that you wanted to talk about today.
It is. From the side, for my profile, you see quite a big lump in the middle of the nose. And from the front on, it veers to the right and then also veers down to the left. And so I just like that to be like straightened and more refined.
Okay. And tell me, do you have any problems breathing through the nose?
No, I don't.
And no problems with your sense of smell?
No.
Good. Okay. You can see by your nose that you have a bump on it which is made of both bone and cartilage, and certainly that is causing the crookedness as well. And so those two things can be corrected by surgery. The surgery is performed by little cuts on the inside of the nose, and then we get access to the cartilage, etc., and make the changes like that. Do you have any questions about the surgery?
It would be more about the appearance. Will it be quite natural, or will it look as though I've had it done?
Absolutely natural. I think the most important thing about any surgical procedure is to make sure that it's natural looking. And we can do that by having an idea with a computer imaging.
And how much swelling and bruising will I have?
We're using very small instruments, so usually we don't get too much bruising, but usually it's just swelling around the eyes only. That will last for around about a week to 10 days. We have a plaster on the nose, and that will stay on for around about a week to 10 days as well. So when can you go back to work? Probably after 2 weeks.
So will you be making any cuts from the outside of my nose?
No. In your case, I'll be performing some surgery through incisions on the inside of the nose only. Sometimes we do have to perform external incisions, but in your case this won't be necessary. So why don't I show you this on the computer, and then we can get a real idea about exactly what we can achieve for you.
That'd be great.
Okay. On the front-on photo here, you can see that the bone and cartilage is a little bit bent. Now we can do some imaging on here using little tools, and you don't see that much of a change from the front. So with the front on, if you look at that photograph again, you can just see some very mild changes to the shape. But certainly when we look at the side view, this is where we see a significant change. We can take this down, and from memory you want just basically a straight nose, so it's important to keep it straight and natural. What I'm going to do is put the changes right next to each other. And again, looking at this image here, what do you think of that?
It's a very big difference.
Okay. So I think the surgery for you is going to be quite straightforward, and I think that we should be able to achieve a very nice, natural outcome that's going to be very similar to what you've seen on the computer imaging.
That's fantastic.
Okay, well, I look forward to performing the surgery.
Thank you.
Okay. Okay, so Byron, it's been 4 weeks since the time of surgery. How's your recovery been?
I prepared myself for the worst and I didn't get that, so it was about 3 days of just lying on the couch and watching DVDs, but other than that I was fine.
And so tell me about the reaction of other people and what you felt about the surgery.
I've had so much positive feedback. The result is so natural and everybody's ecstatic with it, and so am I.
That's good. You had some problems with the breathing beforehand, and we fixed that problem up. And so since the surgery, how's your breathing been?
For breathing, for about the first week was kind of difficult. I felt really blocked up, as though I had like a really bad cold. But once the splints came out, then that was all fine. I actually could breathe better than what I could before.
That's good. And you know, at the time of the surgery, we took down the bump of the nose. We broke the bones to bring in the nose as well. We did some work on the tip cartilages just to again narrow it slightly, and then we also improved the breathing on the inside. And at the end of that, we sprayed the tissue glue to decrease the swelling. So at this point in time, only 4 weeks out, it's very early in the piece and it's looking fantastic, but soon over the next 3 months it's going to look more like what we saw in the computer imaging. So I think what we'll do is we'll get you back in 3 months' time, check it out again, and if you have any problems you can come back sooner.
Perfect.
We'll see you then. So, I hope that you have found this insight into rhinoplasty surgery both interesting and informative. Ultimately, the decision to have rhinoplasty surgery is one that you must make yourself, but I do suggest that you have the support of your family and friends. So do your research, look on the internet, come to my website, and hopefully we can make a decision together for you to have rhinoplasty surgery. So good luck with your decision making, and hope to see you soon.